Good afternoon, I'm Dr. Cosentino. I'm the president of Empire Medical Training. I'm here today with Dr. J Bauman. Dr. J Bauman is a hair transplant surgeon, and he is board certified by
the American Board of Hair Restoration Surgery.
Dr. Bauman is also the #1 hair transplant surgeon in North America. I would like to ask Dr. Bauman a little bit about his practice. Doctor, you also do a lot of non-surgical procedures.
That's right. Well, first of all, thanks for being here. Really do appreciate you inviting me to the 20th anniversary Jubilee. As a faculty member for Empire Medical, we've always had a great time teaching your students, and the interaction that we've had over the years has been great. So we look forward to many, many more years with Empire Medical, and congratulations, 20 years, very, very nice. I don't know if you know this, but also we're coming up on 20 years at Bauman Medical also.
Wow.
They're established right around the same time. So pretty excited to reach these milestones, I think.
Yes, for sure, for sure. Dr. Bauman, if you could tell me a little bit about focusing a little bit on the non-surgical side, a little bit about what you could do for the patient that comes in who may not be a candidate for surgery, or maybe he doesn't want to have surgery, he wants to focus on non-surgical procedures. What can you do for that patient?
Yeah, I think many people are surprised. They think hair transplant surgeons only do hair transplant surgery, but what's really changed over the past, I would say 10 to 15 years, is the non-invasive therapies. And this is a field that's really exploded. I mean, it's not just the lotions and potions from days of old. The snake oil days are gone. We've got FDA-approved medications. We have FDA-cleared medical devices for hair regrowth. We can do everything from cell therapy, stem cell treatments, to compounded topical medications, PRP, platelet-rich plasma. There are so many different interventions now that we can use to help people maintain the hair that they have and restore some of the hair that they've lost, that many of my patients will never ever need a hair transplant.
And it's funny, I didn't know if you wanted to mention this, but I'm actually a patient of Dr. Bauman's, and he did all those procedures, including the surgical one too. So as far as a non-surgical doctor, we're going to be calling on you to teach our doctors, of course, how to do some of these procedures in their practice, because I think even as a primary care physician, they can do a lot. Helping their own patients. So we have some courses that we've been working with you for a while, and we have new courses that we're going to be doing for 2018, which are very exciting, as well as our preceptorship.
I was going to say, the preceptorship programs, the shadowing programs are going to be great, where your students are going to be able to come in and actually shadow us for the day at the clinic, really in what we call the hair hospital situation, and see everything that we do, from the medical evaluations of hair loss and hair loss risk factors, to the measurements of hair growth so we can track that over time, looking at the scalp under the microscope, and then figuring out what is the most appropriate treatment plan for that patient to get them to their goals. And then seeing the procedures and treatments done right there, right in front of them. So it's going to be pretty exciting stuff.
I can tell you, when I came into your office for the first time, it was really a surprise to me. It felt like I was in, you know, some futuristic movie. The technology that you have, even from the treatments for the hair, like the shampoos, that was pretty incredible.
A lot of people don't realize, you know, it's called the Hair Hospital, Bauman Medical Hair Transplant and Hair Loss Treatment Center, because we do so many different things. It's not just for hair thinning and for hair shedding and for hair loss, but we also are very keen on scalp health. So we have a full-time trichologist. We also do non-surgical hair replacement, so the medical grade hair and scalp prosthetic devices. And then of course, the medical management, the customized prescriptions, nutritionals, the hair care products you mentioned, plus the cell therapy, PRP, laser light, and the least invasive hair transplants possible with robotics and manually guided tools to take one hair follicle at a time.
It really is amazing. And also how many people really are not aware that this is available. You know, even, you know, as a physician myself, years ago, I didn't even know that a lot of these procedures were available. So it's definitely good. Thank you very much, Doctor.
Great, Dr. Cosentino, great to see you.
Me too.
And it's a pleasure for me to be here.
Thank you very much.